I often get asked why my daughter needs to be fed through a G-tube, which is a feeding tube in her stomach. And so I'm making this video to explain the significance of her condition and the G-tube in her life. My daughter has what's called dysphagia. It's a disability. It's very, very common in premature infants. It's actually almost all preemies are born with the condition when they're born very early, but most preemies outgrow it by the time they leave the NICU. Some babies will leave the NICU still having dysphagia, but they outgrow it by the time they reach their due date, maybe like a month or two after their due date. Arabella, although it's not uncommon for babies like Arabella to have dysphagia for an extended period of time. Arabella's 8 months old. She's had dysphagia since the day she was born. She's always had troubles eating like in the NICU, and she's never outgrown it. So she may never outgrow it. She might outgrow it within a couple months. It's kind of hard to tell. But what dysphagia is, it's characterized by pain and difficulty with swallowing. So what happens when Arabella drinks liquid that isn't thickened, it will go up her nose. And it's like if you were to take a drink, like when you drink soda or something and someone makes you laugh and it comes out your nose. That's what happens to Arabella, but just from swallowing. It's not like she doesn't know how to properly swallow the milk, so it goes straight down her throat into her stomach. It will either come up her nose or it'll go down her airway. Most of the time, if it does go down her airway, it'll just penetrate her vocal cords, which is the last stop before going into the lungs. Sometimes it'll get past the vocal cords and go into her lungs. The risk of aspiration, which is the milk going into the lungs, is things like pneumonia, bronchitis, things like that. Babies can get very, very, very sick from aspiration. And so that's what is wrong, I guess, with Arabella. She can't properly swallow. And because of that, she had originally gotten an G-tube, which is a feeding tube that goes through the nose into the stomach. And she had that placed just so she could take a break from having to eat, like drink bottles, so she could take a break and get time to mature and grow. She never got over her dysphagia. She ended up needing surgery because she had bad reflux, which is a whole nother story. But at the time of her surgery to fix her reflux, they had placed the G-tube because they figured she was going to have the dysphagia long enough to need something more permanent instead of just a tube going in her nose, which we had to keep retaping. It would fall out often, and we had to put it back in. So they just put a G-tube to make things much easier. It's more of a permanent, like long-term solution. When I try and explain to people when they ask like why she's tube fed, I'll say, well, she doesn't eat enough by mouth, because that's like the simplest way to put her condition, like the simplest way to explain why she is fed through her G-tube. But it's not really that simple, because when I say that, people think, oh, she just doesn't like eating, she's just not very good at eating. That's not what it is. It's not that Arabella doesn't like to eat or that she just doesn't want to eat. It's the fact that she physically cannot swallow properly. And because of her not being able to swallow because of her dysphagia, it causes her pain and discomfort when she's eating, and that's why she'll only eat like 2 to 3 ounces when she gets a bottle, because by that time it's starting to hurt her, it's getting uncomfortable, and she'll just give up, and she decides that's her limit. She doesn't want anymore because it's too uncomfortable to continue. And that's why she must get milk through her G-tube, because 2 or 3 ounces is not enough nutrition for an 8-month-old. 8-month-olds, she's supposed to be getting, I think it's like a little over 6 ounces, like 6 or 7 ounces per feeding, and she'll only eat 2 to 3 ounces per feeding, and that's not enough. If she was not tube fed, she would become malnourished, she would get dehydrated, she'd get very sick, and she'd be in and out of the hospital, and it'd just be a total mess. She needs that extra nutrition through her G-tube. The G-tube also, it really helps. Like right now she has C. diff, which is a bacterial infection of the bowels. She got very sick from it. She's still recovering actually. But what the G-tube allowed us to do is put her on a continuous feed, which is where she's hooked up to a pump, and it pumps milk into her stomach constantly throughout the day. And instead of it going in at a fast rate in large volumes, it'll only drop in a little bit. It drips into her stomach, so she'll get 1.5 ounces an hour for 20 hours of the day. And it allows her stomach to not have to work so hard to digest and not expand and stuff. And if she didn't have that G-tube, she'd still be getting large volumes. She also cannot tolerate large volumes of milk if she's being bolus fed, which means she's getting a full feeding at one time. If she gets a full feeding at one time, she'll vomit it all up. Her stomach physically can't handle large volumes of food, otherwise it just comes right back up, and vomiting is dangerous because they can get dehydrated and they can lose weight and they're not getting nutrition, things like that. So there's a lot of risk factors that come into her not having that feeding tube, and it's very important in her life. It's what's keeping her healthy and keeping her alive. Everyone always comments on how chunky she is. It's because she's tube fed. Before she was tube fed, actually, she was failure to thrive, which means she wasn't growing properly, she wasn't gaining weight. The 2 weeks that she wasn't tube fed, she was teeny tiny. She was only 6 pounds. She wasn't on any growth chart, either for her corrected age or her actual age. She was off both growth charts. She was really skinny. Her skin hung off, it was just a loose skin. She had no fat. Her eyes were kind of sunken in. They're bulging, I don't know, they're she just looked really sickly because she wasn't getting enough nutrition. She wasn't growing at all. People used to ask me if she had Down syndrome and stuff, because she just wasn't healthy at that time at all. And then as soon as she got that NG tube, she started growing. And once she had surgery and had our G-tube placed, that was at the point when she actually began hitting milestones. She started developing. Before then, she did nothing but lay there. She didn't coo. She didn't really make any noise. She did this grunt thing. She cried a lot. She's kind of just laid there. And then we had her surgery, and within days after having surgery, she started smiling at us and she would coo. And now, she's sitting up, rolling over. She's hitting all of her milestones like she should. But without that G-tube, she wouldn't be how she is. And so it's very important that she does have that. Even though it's no fun to have a tube-fed baby, it's an important part in her development. It's something that she needs to survive and grow and develop properly. So I guess that's that explaining. Yeah.